Screening, brief intervention, and referral to treatment, or SBIRT for short, is an evidence-based, integrated, and comprehensive approach to the identification, intervention, and treatment via referral for substance use, domestic violence, depression, and tobacco use. Starting the conversation, engaging the patient, and knowing how to guide women in our care is the key to success. This presentation is provided to assist healthcare workers in conducting screening activities designed to identify women with disorders associated with opioids or other drugs and associated behaviors that can have an impact on prenatal and infant health.
Screening does not take long and can easily be part of your routine patient assessments. Screening questions are best delivered in a conversation with your patient using a validated tool. It is important to stress with patients that these questions are asked of all pregnant women as part of their care and that the purpose is to identify the need for additional services. The Florida Perinatal Quality Collaborative recommends 3 validated screening tools, which can include the NIDA Quick Screen, the 5 Ps, or for adolescents and young adults, the CRAFT. All 3 can be found on the FPQC website.
According to a recent study, using SBIRT can improve adult access to preventative ambulatory health services, improve timeliness, frequency, and adequacy of prenatal care, and improve timeliness of postpartum care. This is a scene that takes place in my practice frequently. Good morning, Helena. How are you doing today?
I'm good. How are you?
Doing well. Thank you for asking. I just talked to Margot, the physician assistant, and she said that your baby's measuring perfectly, that the ultrasound looks good, and all your lab work came back normal. So you must be doing something right. That's awesome. Okay. She did say that there were some of the questions in her screen that merited to talk to you a little bit more about some medications. Can you tell me a little bit about what your concerns are?
It's really scary.
It's okay. We're not judging.
I've been taking Dilaudids. And I've been taking Xanax.
Okay. Are they prescribed to you?
The Xanax is, but not the Dilaudids.
Okay. And how long have you been doing that?
About 15 years.
Okay. And you weren't comfortable bringing that up at the beginning of your pregnancy care?
I thought I could stop.
And that's completely understandable. A lot of women who aren't able to stop when they're not pregnant can find the strength to stop, or at least want to stop during pregnancy. So I understand that, and you probably were frightened to bring it up. You didn't know if you wouldn't be able to get prenatal care with us or if you would be reported. There's a lot of reasons people are frightened to let us know, and it's really brave that you did so. Thank you for letting us know. Any other medications or substances at this time?
No.
Okay, no tobacco, no alcohol, no marijuana?
No.
Okay. And have you been having to engage in any risky behaviors to afford the Dilaudid and the needles?
No.
Good. I'm glad to hear that. Are you in a safe situation at home? Do you have a boyfriend, a mom?
My mom is really supportive.
Okay.
I do have a boyfriend, and I stay with him at his mom's house when she's not home.
Okay.
But I can't stay at my mom's house.
Does she know about the history of drug use?
A little bit.
Okay. So it's not a secure, safe place for you to be with her. It doesn't work out. So when you're not with your boyfriend or at his mother's house, where are you staying?
I stay in my car.
Okay. That must be really hard and frightening to manage that and a job and then coming here to get prenatal care. You've got a lot of resilience. You have a lot of coping mechanisms. You're working right now?
Yes.
Okay, so you're able to afford food and normal things that you need day to day, but it's not a stable environment that you're living in right now.
I have WIC and I have food stamps to help me with food.
And the use that began 15 years ago, did you have any issues of depression or trauma that precipitated starting to use?
I definitely used to just party with my friends, and then it got a lot worse, and I seem to be the only one still partying.
Okay. Well, that's an honest answer. And certainly it sounds like with counseling and maybe therapy, support therapy, we could find some reasons that you find that to be the case and how to help you get around that now. What would you like to see happen?
I just want to have a healthy baby.
And that's commendable. And I'd like to see you have a healthy baby and be healthy yourself and go on to do amazing things in the world. You definitely have potential and you're motivated, and I believe you can be a good mother. So available to you are services in our community that can help with both handling the addiction, either with abstinence-based therapy or with medication-based therapy. We can get you counseling and get you involved in classes that help you learn that this is a disease just like any other disease, hypertension, diabetes. It's no different to be a pregnant woman with these diseases than somebody who has a substance dependence that needs to be addressed. We just need to connect you to those services and make you know that we will not judge you. So what we'll do is we'll get you in touch with the services available in our community for housing, for opioid use. Talk to the doctor that's giving you the Xanax, see if we can help with trauma-based therapy or other counseling, and continue your prenatal care with us so that at the end you're going to be able to have a healthy baby that you take home.
Okay, that sounds wonderful.
Well, we'll look forward to seeing you next week.
Thank you.
Women look to their doctors for advice and consultation, and for many women, pregnancy adds an incentive for behavioral change. Being supportive and non-judgmental is the key. Providing encouragement and support go a long way as well. Remember, SBIRT stands for Screening, Brief Intervention, and Referral to Treatment. Your ability to screen and refer can make all the difference for your patients and the health of their babies.